In this video I'm going to talk about cholinergic antagonist, also known as anticholinergics. This video is part of the series of videos about the autonomic nervous system drugs. If you haven't watched the previous videos, I recommend you watch it. We are going to cover the types of cholinergic antagonist agents, their mechanism of actions, clinical uses, and lastly their side effects. Cholinergic antagonist, also called cholinergic blockers or anticholinergics, interrupt parasympathetic nerve impulses in the central nervous system and autonomic nervous system by preventing acetylcholine from stimulating cholinergic receptors. There are three groups of cholinergic antagonist which we really need to remember them, which are antimuscarinic agents, ganglion blockers, and neuromuscular blocking agents. Now let's go ahead and talk about them. Antimuscarinic agents. These agents block muscarinic receptors, causing inhibition of muscarinic functions. In addition, these drugs block the few exceptional sympathetic neurons that are cholinergic, such as those innervating the salivary and sweat glands. Because they do not block nicotinic receptors, the antimuscarinic drugs have little or no action at skeletal neuromuscular junctions or autonomic ganglia. A simple mnemonic for you to remember antimuscarinic agents is ABCDFGHIOST, where A stands for aclidinium and atropine. B stands for benztropine. C stands for cyclopentolate. D stands for darafenicin. F stands for fesoterodine. G stands for glycopyrrolate. H stands for hyoscyamine. I stands for ipratropium. O stands for oxybutynin. S stands for scopolamine and solifenacin. T stands for tiotropium. Tolterodine. Tropicamide. Trospium and trihexyphenidyl. Now we ask ourselves, what are their clinical uses and how are we going to remember the clinical use of each drug since they are so many? It's frustrating, right? That's why we have a simple mnemonic to help you remember the clinical uses of the most of these drugs, and that mnemonic is the sentence: Parkinson was poisoned with anticholinesterase drugs which led to dilation of pupils and irritable bowel syndrome. He wanted to treat uncontrolled urination and peptic ulcers. Doctor asked if he had asthma and incontinence or even motion sickness, but Parkinson didn't have asthma and incontinence except motion sickness. Now we got a table here. On the left side are the drugs with their brand names, and we have letters representing drugs so that it can be easy to remember the names of the drugs. B stands for benztropine and A stands for atropine, and the list goes on. What is going to happen is at the right side of the table which have the clinical use. We use the mnemonic sentence from the start where benztropine will have Parkinson, atropine will be with was poisoned with anticholinesterase drugs, part of the mnemonic sentence. So here means benztropine is used in Parkinson's diseases and atropine is used as antidote in anticholinesterase drugs toxicity. Cyclopentolate is used in dilation of pupils. Dicyclomine is used in irritable bowel syndrome. And dosage form is intramuscular solution, oral capsule, oral syrup, and oral tablet. Fesoterodine is used in uncontrolled urination, dosage form is oral tablet extended release. Glycopyrrolate is used to control conditions such as peptic ulcers that involve excessive stomach acid production. Dosage forms are injectable solution, intravenous solution, oral solution, and oral tablet. Ipratropium. Guys, these drugs ending with -ium, I'm talking about ipratropium and tiotropium. These drugs are bronchodilators that are used to prevent bronchospasm in people with chronic obstructive pulmonary disease. And here ipratropium is used in people with asthma. And the next one is oxybutynin. Oxybutynin is used in urinary incontinence. Urinary incontinence is leaking of urine that you can't control. Now here is an interesting side of oxybutynin. Oxybutynin reduces muscle spasms of the bladder and urinary tract that help the body hold urine. Scopolamine. Scopolamine is used to prevent nausea and vomiting caused by motion sickness. Trihexyphenidyl. Trihexyphenidyl is used to treat symptoms of Parkinson's disease like stiffness, tremors, spasms, and poor muscle control. Tiotropium. We talked about it as it's used in asthma. Tolterodine is also used in the treatment of urinary incontinence. And the last one is methscopolamine. Methscopolamine is used to treat peptic ulcers, nausea, vomiting, and motion sickness. It reduces stomach acid secretion to help control peptic ulcers. Although methscopolamine does not help heal an ulcer. Now let's see them in details. Atropine are obtained from Atropa belladonna, a toxic perennial herbaceous plant. We really need a mnemonic to remember atropine clinical uses. Which mnemonic is going to save us? Atropa. A stands for antidote for cholinergic agonist, and as a mydriatic cycloplegic, the big key point here is topical atropine exerts both mydriatic and cycloplegic effects, and it permits the measurement of refractive errors without interference by the accommodative capacity of the eye. T for traveler's diarrhea. R for rapid onset mushroom poisoning. O for organophosphorus poisoning. P for pre-anesthetic medication and A for arrhythmia. By occupying muscarinic receptors, atropine blocks the parasympathetic actions of acetylcholine and induces symptoms of the fight-or-flight response. Most prominent are increased heart rate, bronchodilation, decreased motility in the GI tract, mydriasis, and decreased secretions from glands. At therapeutic doses, atropine has no effect on nicotinic receptors in ganglia or on skeletal muscle. Now let us take this question. Sarin is a nerve gas that is an organophosphate cholinesterase inhibitor. Which agent could be used as an antidote to sarin poisoning? A. Pilocarpine. B. Carbachol. C. Atropine. D. Physostigmine. Pause the video and take your time to think about this question. The correct answer is C. Since atropine is used as an antidote for cholinergic agonist and sarin is an organophosphate cholinesterase inhibitor. I just want you to memorize word atropa. Don't forget atropa, guys. Now for administration of the drugs we need to be alerts. First, oral and subcutaneous doses are not interchangeable. Second, monitor blood pressure, pulse, and respirations before administration and for at least 1 hour after subcutaneous administration. General actions last about 4 hours, however, effects of topical administration in the eye may persist for days. And for adverse effects. Expected adverse effects include dry mouth, constipation, urinary retention, and an increased heart rate. Contraindications. Atropine is contraindicated in patients with glaucoma, because the drug may increase pressure within the eye. Atropine should not be administered to patients with obstructive disorders of the gastrointestinal tract, paralytic ileus, bladder neck obstruction, benign prostatic hyperplasia, myasthenia gravis and cardiac insufficiency. And AS for atropine toxicity, the antidote to atropine is physostigmine or pilocarpine. Now for ipratropium, tiotropium, glycopyrrolate and aclidinium. As we talked before, drugs ending with ium, which are ipratropium and tiotropium, are bronchodilators. Ipratropium is classified as a short-acting muscarinic antagonist, while glycopyrrolate, tiotropium, and aclidinium are classified as long-acting muscarinic antagonists based on the duration of action. These agents are approved as bronchodilators for maintenance treatment of bronchospasm associated with chronic obstructive pulmonary disease. Ipratropium and tiotropium are used in the acute management of bronchospasm in asthma and chronic management of asthma, respectively. All of these agents are delivered via inhalation. Because of the positive charge, these drugs do not enter the systemic circulation or the central nervous system. Scopolamine. Scopolamine is an oral, intravenous, ophthalmic or topical drug with many uses, including the prevention of motion sickness. Scopolamine transdermal is used to prevent nausea and vomiting caused by motion sickness or from anesthesia given during surgery. And one thing to note here is you should not use scopolamine transdermal if you have narrow-angle glaucoma or if you are allergic to scopolamine. Now we have another question here. Which is the most effective drug for motion sickness for a person planning to go on a cruise? A. Atropine. B. Physotieridine. C. Scopolamine. D. Tropicamide. Pause the video and think. Guys, again scopolamine is the most effective in preventing motion sickness, so here the answer is again C. Tropicamide and cyclopentolate, these agents are used as ophthalmic solutions for mydriasis and cycloplegia. Their duration of action is shorter than that of atropine. Tropicamide produces mydriasis for 6 hours and cyclopentolate for 24 hours. An overdose of tropicamide ophthalmic is not expected to be dangerous, so this is normal, no need to worry about it. Benztropine and trihexyphenidyl. Benztropine and trihexyphenidyl are useful as adjuncts with other anti-Parkinson agents to treat Parkinson disease and other types of Parkinsonian syndromes, including antipsychotic-induced extrapyramidal symptoms. Avoid driving or hazardous activity until you know how benztropine will affect you. Your reactions could be impaired. Avoid becoming overheated or dehydrated during exercise and in hot weather. Benztropine can decrease sweating and you may be more prone to heat stroke. So no driving, no staying dehydrated during exercise. Get emergency help immediately if any of the following symptoms of overdose occur while taking benztropine and trihexyphenidyl. Blindness. Blurred vision. Change in consciousness. Cold, clammy skin. Decreased vision and dizziness.